Welcome to Just Wanna Quilt, a research podcast coming out of Tulane University Law School, where we explore all kinds of things, stories about quilting, tools, field trips, maybe some famous quilters stop by, and, of course, a little bit of copyright thrown in just for fun. I'm Elizabeth Townsend-Guard, your host. I'm a law professor at Tulane University Law School. I also hold 2 fellowships right now, one at the Business School and one at the Newcomb Institute at Tulane. And I just want to quilt. So today, Jack, or John, he goes by both, John Spartz joins us. He is a medical student and a Master's of Public Health student here at Tulane, and you're going to get to know him over the next few interviews. He's working with us on our Homemade Mask Summit, and he is also helping me interview medical and science people to better understand where homemade masks fit within this world. And he's awesome. So I thought we would introduce you to him with a short interview.
Hi, everyone. My name is John Spartz. Some people call me Jack, and I'm calling from my apartment in New Orleans, Louisiana.
Awesome. And tell us how you came to be part of our team.
Yeah, so that was kind of a story. Initially, Tulane had a grant to put money into the hands of people working on the front lines with the COVID response, specifically targeting underserved communities. And so I put together a project focusing on people who use and inject drugs to try and get them personal protective equipment. And in the process of facilitating the grant process, which didn't end up going through, I met Haley, who's a law student at Tulane, and was kind of doing this like this ancillary project that was to what I was doing that was focused on homemade masks. And after talking with her and her group for a while, we kind of parted ways. And then I got an email from her saying that you guys were organizing this summit and, talked to Dr. Townsend-Guard, and
yes.
Here I am.
And you're a student right now at Tulane. Tell them what you do at Tulane in terms of your focus.
I'm a third-year medical student, and I'm also getting my MPH in disaster management. And so kind of aiming towards the emergency medicine field and also disaster medicine as a future. And so a lot of the COVID response is right in the wheelhouse of what I hope to plan.
Right? Like crazy seriously, like it is exactly like that intersection in this crazy way. That's just, it must be mind-blowing to you to live through it as part of a medical student. And you think about your career ahead of you, that was where it starts, is really, I can't wait to see what you do. But to have lived through it, really, it isn't like a, what if there's an emergency, right? Like you living through it, which is so very interesting.
Yeah, I think one of the things that gets talked about a lot in the public health classes I take that are focused on disaster management are disasters. And so we know hurricanes happen. We know, in New Orleans, they happen not infrequently. And we hear about earthquakes and fires, et cetera. And I have friends in those situations, but you also hear about pandemics, and I've never really been a part of something this magnitude. So right. Before all of it happened, you see a lot of professionals in this field saying it's just a matter of time. Something will happen based on the factory farming that goes on, based on, how interconnected every single country is at this point, with all the international flights occurring, when something that has just the right ability to infect people and just the right kind of host within the human, at that point, it's just going to spread, and it will happen. It's just a matter of time. So, yeah, it was just the time.
So tell me what your life was like before. You just heard me say this in another interview, but tell us what your life was like before this happened. So what was December or January like for you before this?
I finished up public health classes. I was doing medical school classes. I was essentially just kind of floating along, learning things every day. The life of a medical student is oddly boring. In the first 2 years, it's a lot of book learning. It's a lot of at-home time. So into January, I started preparing a little bit, like getting in the right mindset for this big exam I took in May called Step 1. And that in itself, you basically block off about 6 weeks of quarantine time. You are alone in a room with books around you and computers, and you just learn for about 6 weeks straight. So actually when COVID hit, I was they call it dedicated, but I was essentially quarantined, and it didn't really change anything.
Didn't change anything. Interesting. No. That's very funny. Okay. And then you had said something about in our previous interview that you were helping with stuff. What did the medical students do, or what happened to the medical students when this happened, and sort of what role did you all play, or did you personally play in this?
Yeah, so the medical students kind of had a varied response. So each year you're at a different stage of your learning. And so each year kind of had a different reaction to this. And what I found was my class and the class above me had a little bit more free time with all of this because our big exam got canceled and pushed off. So we just all of a sudden had a vacuum of a couple weeks, even a month, where there wasn't really any mandatory anything. So a lot of us started looking to volunteering in the city or trying to help in some way, shape, or form. So I had really good friends that set up a Tulane personal protective equipment drive that started organizing just thousands and thousands of masks and gowns and gloves and everything to give to the hospitals that during that acute phase when things were really not looking that great for the healthcare system down here. And then myself and a lot of other students started volunteering with the Medical Reserve Corps, doing things like temperature checks at nursing homes, temperature checks at the I think, I don't know what they call it officially, but it's the hotel where they were housing homeless people to kind of give them space. I don't know, to keep them out of their camps, and then also to do the federally run testing, drive-through testing sites.
And so what was that like, and how did you stay safe?
So it was, you walk in, there's Humvees, there's, big military equipment, there's tents everywhere, there's a bunch of people in uniform, and you just kind of go in and get nodded through like a little civilian in this like new world of militarism. Everyone there was really, really nice, and everyone had this single goal in mind, which I think is, the military does very well. Just one thing, right? We focus on. And so I was doing the triage sites, which means that cars would come up, they would have marked out, who's in the car, et cetera. And you go in and you talk to them, hi, my name is XYZ, what's going on today? And they would have to say certain symptoms, and then you would kind of gauge based on that and the temperature, whether or not they got a test. And then you send them on their way. And meanwhile, you're in this full zoot suit PPE thing with an N95 mask that you have to rewear the whole day and a face shield down that you have to do. And when you take breaks, you have to like take it all off in the right proportion and then fold up the gown and then unfold it when you go back in. And it's 85 degrees in New Orleans. You're sweating, and it's, right. I don't know.
Really interesting. What an amazing experience. And so, how did you find that experience? Were you, tell me, like, what, did you still want to be in the field, I guess, is when, like, how did this impact who you are, having had this up close experience?
That's a good question. And I think that's probably, I don't know if I'm still in the phase of that kind of transformation, because normally that's a very reflective question. It's very like after.
You're still in it, right? You're like, I don't know yet.
But maybe I can start thinking about it now. But I think it's, in a lot of ways, it's just kind of shown me the veneer that the world and civilization and society around us kind of put up for so long, of that semblance of like pure and total control.
Yeah.
You hear things from, authority figures in your life, and you take it kind of as this truth. And in this time, everything started to dissipate, and not because they're not speaking truth, and not because the science isn't there. It just seemed like everyone's perspective started to shift. And I think mine, I found myself thinking much more in depth about everything being told to me around COVID and in life, et cetera.
Give me an example.
So I think just with the sheer amount of misinformation and also the kind of different information coming out, like my public health degree taught me that when you have a pandemic, you start by tracing the source. So when someone comes into a city, they infect 20 people, let's say. You go find whoever shows up in the emergency department of the hospital that gets reported to you, and you start going backwards, and you find them and you kind of contain them. With this, it's on such a scale that we've never responded to before, that kind of, it's still what we should be doing and what we are doing, but things start to change. It's not that black and white, right? It's not that. It starts to become very gray and difficult. don't wear masks at first and then wear masks coming out, and trying to sort through the literature to say, what should we actually be doing?
Right. Yeah. Hugely. Yeah. Interesting. So very interesting. For our viewers, this is a weird part of your life. So they know Gigi really well. So Gigi is Gigi runs is a big part of our group, Just Wanna Quilt. She teaches us how to sew things and do things, and I know you know Gigi. And Gigi's like best friend, sidekick. They're inseparable. And you are connected to Hillary, which is totally weird, and makes New Orleans, of course, the smallest world ever. So that's very funny. So yeah, we're super psyched. So you're like part of our group, whether you want it to be or not, because you're connected to Gigi and Hillary, and so that's quite adorable. All right, so tell us a little bit about so you are part of our main team now, and our team is really a great team of students from public health and you and the law school and Newcomb, the Women's Institute. Tell us a little bit about what we're planning with the summit and how you're feeling about it. We're in the planning stages, and we haven't officially, we've talked about it, but we can officially announce it on this, that we're doing a summit on June 17th and June 20th, so a Wednesday and a Saturday. So you can watch on Wednesday or listen to it later or watch it later, catch up, and then Saturday as well. So we thought people needed a little bit of a break between the 2 days to sort of absorb everything. And you are part of our planning. So tell me or tell our listeners about what you're doing and what your thoughts are about the summit and how it's all going so far.
Yeah, so I kind of, at this point, have taken on part of the role of just organizing the science sort of sector of the summit. So taking public health professionals who are my professors and hopefully one day my colleagues, and also medical professionals, physicians and professors who, again, I see every day in school and hopefully will work with one day. And it's taking them to get their expert opinion and insight into this constantly changing topic of homemade masks. And I know that the quilters of America, the sewists of America, basically anyone with a sewing machine that, even people who know someone who has a sewing machine, they're now at this point where they are in charge of building something that's supposed to protect another person or protect themselves. And they really aren't armed necessarily with all of the tools to sort through the data and the knowledge to come up with the best possible mask they can. And they're being told so many different things. And so my whole goal and the goal of the summit, I think, is to clarify a lot of the perspectives of the homemade mask world that has arisen, and to hopefully bring some science and data and understanding to everyone about what to do with homemade masks.
I think it's great. And it's a 2-day event. It's 10 hours, 5 days each day. We'll have more information. You'll be able to sign up. It'll be on Zoom, but then it'll also be broadcast, the podcast, so you can see people. And then it will also be broadcast on the podcast the next day, and then also we'll put it on YouTube. But I'm really hoping that you and Hillary and others, no, not Hillary, Haley, you and Haley, sorry, Hillary is somebody different. You and Haley can, Haley is our law student that you all know that's really been working on the science side, trying to understand, use her super smart research skills as a non-scientist to try to understand the science. So I'm really hoping that you and she can get together, sort of understand what's happening now, and then as we listen, help us understand as we finish the 2 days, kind of a wrap-up of what we've learned and what we need to sort of understand to go forward. Because the idea really is to put together just a short one-page summary of what the experts tell us and how we can help, and so we don't feel like we're harming people. And so I think it's going to be really exciting to see what everybody did, and but also have something come out of it, so we feel like, oh, okay, we probably shouldn't do that, or maybe we should do that, or I imagine we'll be talking to you again as things change. Be like, we need to go and ask again. Now, do you like being called John or Jack? Because you've got 2 names, and 2 names is always hard. Everybody gets confused, right? So what do you want us to call you? Because I know they'll want to know too, our listeners.
I suppose professionally, you feel free to call me John, because it makes the most sense, right?
Yeah.
But personally, if you ever meet me or like that, like in person or hanging out with Jack is perfectly fine.
Got it. Okay. So good. All right, cool. Well, I am super psyched. I cannot wait for people to meet you. You have been so nice to chat with and so smart about things and respectful. And I think that that's a really great combination, because I think the homemade mask community, we were asked to make them, and then sometimes people are a bit mean, and you're super respectful of the fact, sometimes people are like not nice to us, and they think that we're just being ridiculous, or like we're not, I know, and they kind of discount what we did, and you don't do that, and I appreciate that. I think that what we want to sort of tell the story of what we did because people asked, and how to make sure that we do it as safe as we possibly can if we need to in the future.
Yeah, absolutely. I mean, to me, it just seems like, it's just an expression of caring at that point, right? Yeah. Because all you're concerned about is the health and safety of someone in your life or someone you love, and you're trying to do your best based on the guidelines that are out there put out by the CDC to arm them with what you can. And the fact that you're listening to this and listening to the summit on the 17th and 20th means that you care enough to actually go to the source and see, what people are saying about it. So that's, happy to be here. Thank you.
Thank you. All right. Fabulous. And you okay with us posting this? Yep. Okay, cool. Hold on just a second. So you've been listening to Just Wanna Quilt, a research podcast coming out of Tulane University Law School. And I'm Elizabeth Townsend Gard. If you like this podcast, keep listening. Also, we have a Facebook group. Come join us. We talk about a lot of things. We also have an Instagram account. And of course, most importantly, I really hope you get a chance to quilt today.